you see today are actually cooling them immediately. And that's quite important, and I never sort of went into that. So we do believe in cooling. I don't know whether you need to cool for 24 hours, but what we do know is that the sooner you start to cool, the better the outcome. And so Nicholas, in addition to giving the drugs, will hang a bag of cold saline. It's not ice cold saline. And then in the recovery period, they'll put one of these towels on the pig's belly, pour a 50% alcohol solution on that, solvents and chemicals can be used, including just water with a fan. And when it evaporates, it will cool the animals down pretty quickly.
At what point do you initiate
60 seconds?
What's that?
60 seconds.
60 seconds. We initiate cooling once we know that the pig is stable. So you'll see that today.
Post-resuscitation.
Yes, post-resuscitation. We have actually done CPR studies and cooled during CPR. If you do it with standard CPR and ice cold saline, you can't circulate through the lungs. It builds up. If you do it with these devices, you can circulate and cool during CPR. I'm not sure we need to do that based upon what we're seeing, but I can tell you for sure. 15, even 10 minutes down is a long time. 15 minutes down is a little longer. So I don't know whether it's an added advantage to doing it during CPR. I do know you can screw things up in an ambulance if you put too much behind it. That's not big. So we're going to start chest compression. Scott's going to start slowly so we don't break the ribs. The ribs are fragile in these pigs as well as
5, 4, 3.
Are we actually anesthetized now, or did we remove the tracing?
He removed the tracing. We'll go back and take a look at that. So here's a positive pressure breath, and that just slowly grows as we are. So initially, when we start to do CPR, we see a rise in the carotid blood flow, in part because the endogenous stores of catecholamines are all being released at this very moment. So it will go up relatively high. It's peak up at 50, and then it will come back down a little bit to a baseline. So as Scott increases the chest compression depth a little bit and allows for a good recoil, you can see a little tiny vacuum developing with each recoil with standard CPR. And this is scaled to show the aortic pressure, but this is actually the 0 point at 75 for the intrathoracic.
4, 3, 2, 1. Mark.
So
Again, as it is in.
we start seeing intrathoracic vacuum right away. From that, you see a striking difference there. So conceptually, we say, okay, ALS has arrived. They have their IO in, and now we're giving the drugs. We're giving ACD and ITD. It's important to note that in our rescue trial, we actually did active compression, decompression, and a special device at the BLS level, but brain flows up to 90, 100 now, so we go from 30 to 100 as we deploy this therapeutic approach. Pig is gasping, it's a very good sign.
1. Now try it in.
But she's perfusing more, yeah. Yeah. Oh, yeah, thank you. So Scott points out that the sodium nitroprusside is a big. So if we take our values now, we have a systolic blood pressure of about 70, diastolic blood pressure of about 35.
5.
The airway pressure is about minus 10 or
1.
so.
Here. Here.
Turn off the compressor, please.
Yeah.
Okay. Good, yes.
So at this point, we're going to give some amiodarone. We're going to give an AMPA bicarb because we were down for 10 minutes. So a lot of this stuff is a little sacrilegious compared to what we've been doing and teaching. But the blood pressure is off the screen. You gave a half a dose of epinephrine, is that right?
Yeah.
Yeah. And the other thing that we found is that these pigs are super sensitive to epinephrine. So we don't give a milligram, we give a half milligram of epinephrine.
Is there a reason why you stopped the compression
controversial question, right? And there's some data that suggests that we can actually re-induce VF. And so, this is one of these things that Demetrius and I actually may disagree on. As an electrophysiologist, I don't like the continued mechanical bombardment, and I've seen that re-induce VF. Profound vasodilator, including the skin. So, yeah. So as the skin vasodilates, we put alcohol on it. It's even easier to cool it down. So there's some benefit and some synergy as you start to add these therapies together. And tidal CO2 still hasn't moved as much as it normally does. Okay, it is what it is. What's that?
It's a gas machine, so.
Maybe.
On top of AP,
So the epinephrine will take that 100 throughout blood flow and shrink it down to less than 50. So as you remember from your teaching or your learning about epinephrine, you can't use end-tidal CO2 as a guide when you're using epinephrine. And that's because it's actually clamping things down. So it may not increase perfusion, but it's clearly going to increase blood pressure. And you'll see this diastolic blood pressure starting to come up here now. Going to give unfortunately with this machine, an asynchronous shock, but hopefully it will work.
here.
So, if you think about translating this to the street,
That was asynchronous.
you realize that a couple things have to happen. Ideally, you want a mechanical device to do this CPR so that you, as the physician or medic, can concentrate on the patient rather than all of the chaos at the scene. Now, we know that you can do active compression compression and use the impedance threshold device and improve circulation, but you can't do that forever. So if you have more than, let's say, 5 or maximum, I'd say 10 minutes of CPR, ideally you want to do it with a mechanical device. If you talk to the firefighters in those 7 cities that used ECD plus ITD, they'll say doing it for 30 minutes, which was the period of time we said you had to do CPR for 30 minutes, is a very long period of time to do it without rotating a lot. On the other hand, we had people come back at 28 minutes who are walking around today. And so that's the other thing that's happening. We're going to extend, and we want to extend the time that we do CPR to a longer period of time because it takes a while to prime the pump, as you saw today. Priming the pump is a dynamic process, and we just